Hey folks, just want to do a quick educational video on TXA or tranexamic acid. What is this medication? This medication is an anti-fibrinolytic. Okay, let's break this medication down. Fibrin, the root word, fibrin is a blood clot. A lytic is a breakdown of. And anti is stopping the whole thing. What we don't want is we don't want a breakdown of the blood clot. The clot has already formed. So TXA does not act on a forming blood clot. It acts on an already formed clot. How does it do it? In the body is always looking to see if that clot needs to be broken down for some reason. What it does is it releases plasminogen. With plasminogen, when it attaches to the blood clot, it makes plasmin. Plasmin breaks down the blood clot. If an internal hemorrhage is what we're giving this medication for, is we don't want that clot that's already formed to break down. So we give TXA. What does TXA do? It hits that receptor site in the plasminogen, therefore not allowing it to break down that clot. So why are we giving TXA? We're giving TXA for traumatic injuries with suspected internal hemorrhage. We are giving it, some of the indications of it is systolic pressure. It was less than 90. Patients 65 years or older with a blood pressure less than 110 systolic. And tachycardia or signs and symptoms of hypotension, again dealing with a traumatic injury. Some of the hypoperfusion issues might be confusion or cool extremities. Contraindications of this medication, why we're not giving it. We're not giving it to any injury that's over 3 hours old. We're also not giving it to evidence of DIC or disseminated intravascular coagulation. So if someone has little blood clots everywhere, it's what they shouldn't, because that's a sign of infection, not just a quick traumatic injury. Some cautions. Cautions is if that patient has ever had a pulmonary embolism or a deep vein thrombosis, then we're probably not going to give this drug, or we're going to be very cautious in giving it. And it does also cross into the breast milk of a nursing female. Okay. Some of the side effects of this medication. What's it going to do to the central nervous system? It can cause anxiety, it can cause confusion, it can cause blurred vision. What's it going to do to the cardiovascular system? If it's given too fast or under 10 minutes, it can cause hypotension or tachycardia. What's it going to do to the GI tract? Nausea, vomiting, and diarrhea. The respiratory tract, a cough or shortness of breath. Some interactions it's going to have is it could have interactions with birth control. So if a lady's on birth control and she already has a high risk of a blood clot, then TXA can increase that risk of blood clotting. Dosage. How are we going to give it? TXA is going to come in a 10 milligram vial, a 10 ml vial with 1,000 milligrams. So it's 1 gram, and we're going to mix it into our 100 cc bag of D5W or normal saline. It'll go either one, and it's compatible. We're going to mix that in there, mix it up, and drip it with a 15 drip set over 10 minutes. So with a 15 drop set, 100 ml bag, 150 drops per minute will equal your 10-minute time. And again, if you give it too fast, faster than that, it can cause hypotension. Why are we giving it? We're giving it for internal hemorrhaging. External hemorrhaging still has to be maintained by direct pressure, and if you got the new hemostatic agents, you can use that. So also, after we're done with this, what do we need to document? We need to document what time the injury was. We need to document what time we started the TXA, what time we finished the TXA. Thanks, folks.